good day, Atlanta, and welcome to the UnitedHealthcare Stop COVID-19 Town Hall. We're so excited to bring you some great information with an amazing lineup. This is a virtual presentation, again, presented by UnitedHealthcare. I'm your moderator for today, Shana Thornton. Now, you're going to learn some very intriguing facts that is going to help you, your family, friends, and neighbors. I don't need to tell any of you that COVID-19 was a very devastating pandemic. And as the world and the nation and Georgia and Atlanta emerges out of it, we still need to be armored with more information and vaccinations. And that's why today we're putting the spotlight on how safe and effective vaccinations are as we all continue to be as safe as possible. So much information out there. There is talk of an emerging new variant. So what does all of this mean? We have a panel of experts that will address it head on. Let me introduce you to this amazing virtual panel. First up, we have the one and only CEO of UnitedHealthcare, Michael Cotton, and he will be speaking about the important role his organization has in combating COVID-19 and also addressing some of those important statistics as well. We also have with us Reverend Bronson Woods. He's with Ebenezer Baptist Church, the assistant pastor for outreach and young adults. He will be speaking about the collaborations that many faith groups have had throughout the Atlanta area when it comes to spreading information and getting individuals empowered with knowledge. We also have with us Nicole Johnson, and she is with Eat Right Atlanta. She will be addressing food insecurity. Did you know that food insecurity actually skyrocketed throughout COVID-19? She's going to take that important topic on and more. And last but certainly not least, we have Dr. David Williams with Southside Medical, and he will be speaking about the role his organization has played with COVID-19 and also really addressing and acknowledging some important medical facts out there. There's so many urban myths and information that people are spreading that's not always accurate or responsible. And of course, today's presentation is all about getting you the right information at the right time. Again, so you're armored with all you need to know about COVID-19. Well, let's dive right into it. Help me welcome CEO of UnitedHealthcare, Michael Cotton. Michael, thanks for being on with us. Your organization has played a vital role. What exactly have you all been up to lately to combat COVID-19?
Well, thank you for having me, first of all. United Healthcare has been greatly involved with our communities and our partners in the community to help educate, outreach, and really serve individuals to make sure that they're not only aware of the issues around COVID-19, but also learning more about the importance of vaccines and getting vaccinated. Our mission is helping people live healthier lives. In order to do that, we think it's just extremely important that we're in the community partnering with our provider partners and making sure that we're providing those needed services and supports that are necessary for people to really understand how they cannot contract the disease, and also making sure that they're doing the things that they need to do to prevent from contracting COVID-19. As we think about our communities, particularly those in our community and state business, we're really talking about many individuals who are African American and Latino. And we do realize and understand that within those communities, there's a high degree of hesitancy in order to access or take the vaccine. We think the outreach and the education that we're doing with our community partners, such as Southside Medical, will help us do a better job of helping people understand the importance of getting this vaccine and making sure that it can impact them in a positive way. As we know, with minority populations, they've been the most hardest hit with this COVID-19 disease. As we look at the vaccine rates across the state, as we look at Georgia specifically, we're only running about 33, 34% vaccine number of people who are receiving the vaccine. And then our minority populations, that number is in some cases less than half that. So educating, outreaching, working with community partners, serving people and meeting people where they are is just extremely important to make sure that we can get as many people vaccinated as we possibly can. In addition to our work with partners, we're also doing things that are helping with what we think are what we call social determinants, helping with food. So those are other things that we're doing as we're helping and again, trying to be a good steward and partner with the state and with our community partners to be able to help our members and really all patients with this terrible disease. As we seek to partner with a number of organizations, we'll be working with a couple of others along with Southside. For example, Ebenezer Baptist Church will be holding vaccines and vaccine opportunities through July 31st. We'll also be working with Bible Way Ministries, who will be providing vaccine accessibility Tuesdays and Thursdays through July as well. Our goal at UnitedHealthcare is to be a steward and to be a good partner. And the more that we can work with these organizations and more that we can support them, we feel very good that we'll be able to stop the spread of COVID-19 and really see a point in time where we'll be able to get back to a level of normalcy where everyone can live their healthiest life possible.
Thank you so much, and congratulations, United Healthcare. You all have been very, very busy out front concerning COVID-19. Well, everyone, continue to stay with us because today we're speaking with more community partners when it comes to addressing this very serious pandemic as the world continues to emerge out of it. One of the organizations that United Healthcare has been working with in the South Fulton area is Ebenezer Baptist Church. Thank you, Reverend Woods, for being on with us. Your church obviously has observed a lot in terms of testing for COVID and also rolling out the vaccinations. What have you observed and what's important for all of us to keep in mind?
Yeah, so since the very beginning of the pandemic, Ebenezer Baptist Church has provided a response. Though the building is closed, the church remained open. Ebenezer is known as an urban-based global ministry, and through our partners at UnitedHealthcare, we were able to provide a response to the community at need. We were providing the face mask kits and hand sanitizer, as well as providing testing all throughout 2020, like I said, through UnitedHealthcare. The community responded tremendously. As you know, the pandemic was pretty scary for everyone locally and globally. But to think that they had a place to go, a local place, a place of familiarity, a place that they perhaps go to church, a house of faith, it provided a sense of comfortability for them to come and to get vaccinated. Well, initially it was being tested and being able to receive the necessary things, the face masks, which have been a great benefit to them. Because you got to understand, at the very beginning of the pandemic, there was like scarcity of the mask as well as a hand sanitizer. And then we moved on to providing vaccinations. Again, being able to be accessible, local, to provide. Like I said, the building might be closed, but the church is still open. So what we did was we invited the community at large to meet us on the front side of our church or the back side of our church, where we would have a mobile vaccinations on certain days of the week. And we also had, we call it COVID testing Tuesday, every Tuesday on the church's campus, just to ensure that the community had access. So at the very beginning, everyone was coming to be tested because they didn't know what was going on. And of course, we went into providing the vaccination because at that point, you know, it was only phased out. You know, we had, of course, the older persons who were going to receive the vaccinations and those who had preconditions. But then when we opened the floodgate, if you will, the state, I should say, allowed everyone to pretty much get it, we were one of the first ones to open our doors to provide the vaccination. And probably several hundred to maybe close to 2,000 have come through our campus to receive the vaccination. And the fact that we were able to provide it various days of the week. We've provided it on Thursdays, we provided it on Saturdays, we provided it all day long. And we got to the point to where we have just, walk-ins are welcome. We welcome the walk-ins. Again, just trying to provide access. And so not only have we provided the testing and provided the necessary kits, the safety kits, and the vaccinations, but we also were able to provide, to address some of the food insecurities in the area. As you know, since the pandemic, it has caused a lot of shift in a lot of people's employment. And so we were able to provide, and to this day, still providing a little over 10,000 pounds of food every 2 weeks to those who are in need, the working poor also being able to provide access to, for those who are struggling and are in need of help. So we provided food, we provided the safety kits, we provided the testing. Like I said, we're just Ebenezer Baptist Church. Ebenezer is known as a stone of hope. What better way to provide than that of providing hope? And we would not have been able to do this without our partnership through UnitedHealthcare, who had provided a safety kit that was filled with face masks, hand sanitizer, paper towels, toilet paper, just the basic needs that folk in our community were in need of. And so thanks to UnitedHealthcare, we were able to do that.
Well done, Reverend Woods. Congratulations to your faith-based organization for all of the work it continues to do in the community in keeping COVID at bay. And I know you will continue that very important work as well. Well, work to do, there's lots of it that's out there that needs to be done. And food insecurity, of course, is one topic that continues to be in the spotlight. Of course, during COVID-19, it did skyrocket. We have with us right now, Eat Right Atlanta, the one and only Nicole Johnson is with us. Nicole, you saw a lot of food insecurity. What would you want this viewing audience to keep in mind when it comes to food insecurity during these very challenging times?
Thank you, Shana. One way that the COVID-19 pandemic has affected farmers is really significant. Nobody's really talking about that. A lot of farms have closed, especially small farms. They didn't really have access to the pandemic funds. I know now they're trying to fix that, but for a lot of farmers, it's too little too late because they went for a year without any money. And then they also didn't have a way to sell their food, and they didn't have workers. So a lot of produce stayed in the farms, just not picked, and just went bad. And for that reason, people didn't get it. It wasn't given away. You had some farms where they were able to do that, but again, they needed help. They needed money and they needed people. And because of the disease, they did not have that. So a lot of farmers went out of business, which means that there's a scarcity of food. And we're also dealing with weather issues having to do with what went on last year and early this year, especially places like Texas where they had lots of flooding. So those crops are done, and we're not gonna see anything from them until next year. So because of that, there's just less food. Because there's less food, food costs more money. And because it costs more money, you have a lot of people who can't afford to get it. So here we are again, where people are just eating at the gas station. They're, eating fast food. They're saying it's too expensive to buy broccoli, or buy lettuce, and they eat other things, and then they're sick because of it. So that's another really important thing that really I don't think we're having a large enough conversation about. And it really is something that's going to affect us this year, next year. And from now on, from what I understand, there's going to be a worldwide food crisis because of this. So right now, we're at Southside Medical with the vaccination program, trying to encourage people to get their vaccines and to give them bags of fresh fruits and vegetables to take home as kind of as an incentive and as a way to tie in medicine and health, because in truth, food is the best medicine. And what we've been seeing are a lot of people who, come in and they don't have money. They really don't have ways to eat better or just simply live, just because of what has happened this past year. So this is really, it's concerning. We get a lot of calls on a regular basis for people who say that, they don't have assistance, or what assistance they have, they're using just to get by on a daily basis. And lots of times that doesn't include food. So there's really a need for assistance programs, or a way to find a way to really help people eat better. Because once they eat better, then they can do the other things that we want them to do, which is work and, go to school and do the regular things that everybody else gets to do. But if you're not focusing on nutrition, then all of that kind of falls by the wayside. So that's really something we think about this every day, and ways to really help people do better, because we know that once you're feeding them, they will be able to do all the things that they need to do.
Wow, Nicole, your organization is truly making a difference. Thank you for getting the word out, that information, and helping us understand ways that we all can help. Well, speaking of help, there's so much out there to be done, as we keep emphasizing on today's special presentation. We have with us Dr. David Williams with Southside Medical. Dr. Williams, we can address so many different components, the vaccination, how effective it is, and helping bringing the numbers of COVID down in the Atlanta area. But we also see there's reporting of hesitancy among community members. Can you address that and talk about really the safety and efficacy of the COVID-19 vaccinations?
Yes. At Southside Medical Center, as a community health center, we wish to make sure that we erase a lot of the doubts and concerns that a lot of people have concerning the vaccinations. And so not only do we wish to provide them, but we want to make people feel comfortable. So what I'm going to try to do is answer some of the most frequent questions that we get from individuals all the time, because there's so many myths and other things that are being dispersed in the different social medias. So one question I always get is, what are the long-term risks? Well, the way we measure that in a scientific way is based upon what has occurred since the first vaccination. And so every month we review those individuals who had vaccination and determine if anything has happened. And so far, we have found that little or no side effects are occurring for those individuals who have received the vaccinations. And the way the vaccines are designed, it is not expected that there should be any long-term risk. They're really designed just to stimulate your immune system to recognize the virus and thus fight against them. Some people ask questions such as, I'm diabetic. Does vaccination risk my health? Well, just the contrary. As you might have heard, if you're diabetic, if you're overweight, if you have hypertension, or all three of those, you're at greater risk of suffering severe side effects should you acquire COVID-19. And what that means is the benefit far outweighs the risk. And so it is very advisable if you're diabetic, hypertensive, overweight, to really get this vaccine as soon as possible to avoid the consequences. Most of the individuals who end up in the hospital or who have died from COVID-19 have one or several of these types of chronic diseases. One of the questions we get from many parents is, should my children get vaccinated? And what we've learned is that both Pfizer and Moderna now have come out with vaccines that are safe for children ages 12 and up. Even though we know that children who have acquired COVID-19 in the past did very well and very few got sick, there have been cases of children who seem to be quite healthy who've actually ended up dying. So it's very important that your children get the COVID-19 vaccine as well. Likewise, children can be a source of infection for adults. So having your children vaccinated will help to avoid them passing on to a susceptible adult. Another question that I get asked all the time is, how do I know which vaccine is best for me? Well, there's several vaccines. The ones that are approved right now in the US are the Moderna, the Johnson & Johnson, and Pfizer. All provide similar results as far as effectiveness in reducing severe effects of COVID-19. Even though there are different types of vaccines, one is called an mRNA messenger vaccine. Basically, they create in the lab a type of a protein that causes your body to recognize something similar to COVID-19, and thus your body develops antibodies called B antibodies and T cell lymphocytes, which recognize the COVID-19 virus and they fight against it. Whereas the Johnson & Johnson is a vector type vaccine, which uses a virus that is not COVID-19, but has some proteins that are similar, and your body, again, when they inoculate that, your body recognizes it. Now the Johnson & Johnson, they give you a larger dose up front, and so you only need one vaccine, and this is very useful for individuals who perhaps will not be able to come back for another vaccine, whereas the Pfizer and the Moderna both require 2 vaccines, and they give smaller amounts during the initial injections, and you follow up with a booster shot, which causes your body to react and does provide higher concentration of antibodies and providing greater protection should you be exposed to COVID-19. So each has its pros, and many people also ask, but what about the symptoms? Can I get COVID-19 from the vaccine? And the answer is no, since vaccines do not carry COVID-19. However, that does not mean that if you have the vaccine, you cannot get COVID-19. There have been cases where people have received the vaccine and then got COVID-19 shortly after, and it's likely that the vaccine had not produced enough immune response before the virus attacked their system, or individuals, despite having had the vaccine weeks before, may come down with COVID-19, and they call that a breakthrough. Despite this, it is very rare, and those individuals have been shown not to have severe infections when they do come down with COVID-19. A question for those who are diabetic is, can the COVID-19 shot affect my sugar levels? And no, remember, it basically helps to protect you. Sometimes because you're having an immune response, you might find a small drop in your sugar level, but not enough to be of concern. At the end of the day, it is far better to receive the vaccine than not to receive the vaccine. I think everybody has watched the news where literally hundreds and thousands of people, both in the US and even here in Georgia, have come down with COVID-19. And many are still suffering from the consequences, long-term effects of this virus. So the risk of not getting the vaccine far, far outweighs the benefits of receiving the COVID-19 protection. Finally, I would say that at the end of the day, like many other vaccines, this has saved, and we've already seen, has saved the lives of millions of people. The amount of new infections in the US has dropped to an all-time low, indicating that this vaccine is being effective. To date, a little over 50% of the Americans nationwide have received the vaccine, and Georgia is one of the states that we have received the lowest number of vaccination rates, putting those individuals here in Georgia at risk. So the more individuals that receive the vaccination, the greater the resistance population-wide. And it will allow us to one day completely control this virus. This is why it's important for everyone to be vaccinated.
Wow, such great information. We told you we would address the urban myths out there. Thank you so much, Dr. Williams, for putting the factual information up front for all of us. And speaking of all of us, we're all in this together. Atlanta, Georgia, the United States, the entire world, because it's going to take all of us to really beat down COVID-19. I know all of us want to return to some sense of normalcy very soon. We thank you for joining us for today's show. It was a very important conversation. Of course, we want to thank again our virtual panel participants. That was Michael Cotton, that was Reverend Bronson Woods, Nicole Johnson, and Dr. David Williams. So important for all of the information you have shared with us. Speaking of sharing, I want to emphasize again, share this episode with all your family, friends, neighbors, put it on replay, start a watch party on different formats of social media, because knowledge is power, so we all stay empowered. Vaccinations are available now, okay? So please certainly stay connected with the right information and get vaccinated and stay as safe as possible. Well, our Atlanta audience knows best that Atlanta is one great city. It's a great area, and we have a lot of proudness with us, as we should. So when it comes to being proud, we want to be here as long as possible and keep up the best version of ourselves. So it's going to take all of us together to stay as important together in this together. Get vaccinated, Georgia. Get vaccinated, Atlanta. Get vaccinated, family and friends. Thanks for watching us.